President, President Trump signed a bill, major reforms regarding pharmacy middlemen. This is in MedPage today. This was from February 5th. The pharmacy middlemen at the conversation here are the pharmacy benefit managers, the PBMs, and these are probably the worst perpetrators of price gouging and keeping drug costs high and our overall total. I don't want drug prices to be high. I know some people need them. Our goal and our mission is to keep people off of drugs and away from surgery. So I don't really have a horse in that race. I do think our overall healthcare costs need to be less. And for medications that are needed, I think they need to be less costly. The pharmacy benefit managers drive these things to the roof, and they're owned by the insurance companies and the drug companies, and they're all sort of bed together with this the hospital corporations. They weren't invited to that party, by the way. It's like a P. Diddy or a Jeffrey Epstein going on with the pharmacy benefit managers, the pharmaceutical companies, the insurance companies, the hospitals. There's some really bad relationships there. But Trump signed a bill that basically says they have to now pass all the rebates on properly. Look, I don't know where this is going to go. I'm not going to hold my breath. I'm glad he's trying to do something, but I would not hold my breath because it wasn't that long ago. PBMs were forced to change the way they did business, and they just found a way around it. They actually now are funneling money overseas into other corporations and getting money back that way. These are giant corporations, multi-billion-dollar corporations, and their goal is to keep as much money as they possibly can and charge as much as they possibly can for drugs. It's never been about saving the consumer money. And as far as those companies go, it never will be. Look, if you have money invested in pharmaceutical companies and health insurance companies and pharmacy benefit managers, and you're complaining about the cost of healthcare, it's kind of funny as you're hoping that this money over here is making you money, but it's investing money in the same companies that are costing you money. You're spending it over here in your healthcare costs. I would just caution you, if you have money in your mutual funds, your stocks or whatever, and they're in health companies, you should be paying a real close attention, unless you're just about the dollar. But if you're trying to protect the health and the costs of healthcare for you and your family, you should be watching where your money's invested. I'm Dr. Dave Morris of Magnolia Medical Center here in Murfreesboro, Tennessee. Stay healthy, be well.